Hello, and thank you all for joining us today. My name is Mia Cifuentes, Research Assistant. Today we're going to talk about how to manage blood pressure by eating healthy. Today we're going to talk about healthy eating specifically in relation to heart health. We'll go over healthy eating and why it's important. Since we're focusing on heart health, we're going to talk about ways to lower salt in your diet. We'll also go over what to look for on a food label. Let's go over some general things about healthy eating. Healthy eating is making healthy food choices most of the time. There will be times when we can't, but we should try to minimize those times. It involves finding new ways to make healthy food and to make it taste good too. It can help manage and reduce risk for conditions like high blood pressure. The first step of healthy eating is knowing what healthy foods are. Remember the three main groups: plants, protein, healthy fats. Plants include fruits, vegetables, and grains. Protein to focus on are lean meats like poultry and fish, also tofu and beans. Healthy fats, known as unsaturated fats, include olive oil, nuts, and avocado. Foods to avoid include those that are high in sugar and sodium, and that have unhealthy saturated fat. It is also recommended to avoid processed foods. These are the foods that come in boxes and packages. Choose whole foods when possible. You should reduce sodium intake for a healthy blood pressure and overall heart health. Processed foods are often high in sodium or salt. Remember, skipping meals is not healthy. It is important to eat at regular intervals. It's also important to stay hydrated. Drink water. Avoid drinks high in sugar like juices or soda. It is also best to avoid drinks containing alcohol. Avoid adding salt or cooking with salt. If you must, always taste your food before you add salt. Instead of putting salt in your food when cooking, add spices and herbs like pepper, lemon, garlic, and onion. Avoid packaged foods. If you can't avoid it, choose low or non-salt options. Use fresh or frozen meats, fruits, and vegetables whenever possible. Avoid cold cuts, canned, or other processed meats as these are high in salt. When eating out, ask for your food to be cooked without salt. The recommended daily intake of sodium for someone on a sodium-restricted diet is 15,000 milligrams, or 2/3 of a teaspoon of salt. For regular diet, it's 2,300 milligrams, or 1 teaspoon of salt. Let's look at your food label handout. What are some things that stand out? One thing to note is that the serving size is not the whole bag, but 15 chips. That means you're eating more of these nutrients than the table shows. You'll have to multiply all of these numbers by 8 because there are 8 servings in the bag. In this whole bag, there are actually 80 milligrams of fat and 8 grams of total sugar. And how many milligrams of sodium is there? Yes, the whole bag of chips has over 13,000 milligrams of sodium, or 1/4 teaspoon. That's almost all the recommended 15,000 milligrams per day. The DASH diet, Dietary Approaches to Stop Hypertension, is an easy-to-follow, flexible guideline to adopting a heart-healthy eating lifestyle. The plan emphasizes choosing foods that are low in saturated and trans fats and low sodium. This means eating the healthy foods we mentioned earlier: poultry, fish, whole grains, fruit, vegetables, and healthy fats. The diet also requires that you limiting these things like fatty meats, processed foods and drinks, and sweets. It's good to speak with your healthcare provider about your sodium intake and overall diet. Your primary care provider may refer you to a nutritionist or endocrinologist to help you manage your diet. Something important we want to highlight: your provider may tell you that there are certain foods you should avoid when taking some medications. For example, those taking certain blood thinners should be cautious of the amount of leafy greens they eat, so they would need to increase the other kinds of vegetables they eat. If you have any questions about this, speak with your healthcare provider. Let's wrap things up. In the end, the goal is to establish a healthy eating pattern and make smart eating choices for your overall health. Be kind to yourself as you make changes to improve your health. Be mindful of how much sodium you're eating in the packaged foods by looking at the serving size on the food label. A clinically proven guide to healthy eating is the DASH diet. Thank you everyone for your time today.